Fiona. Good afternoon, everyone. Thank you for coming out today. Can I start by extending my thoughts, and I'm sure every West Australian's thoughts, to the people of southeastern Queensland and northern New South Wales. It is devastating what is happening there at the moment, with at least 7 lives lost to the flooding. Thousands of homes have been flooded in what appears to be some of the worst floods in memory. I contacted the Premiers of Queensland and New South Wales, offering any help we can to those states and to those people affected by this disaster. Our DFES personnel are ready to be deployed as soon as New South Wales or Queensland request assistance. The resources have been put on active standby, ready to go. This support could be provided as early as tomorrow, once a request has been received. With regards to Cyclone Annika in the north of Western Australia, it is now across the coast. There is concern about potential flooding. The Kimberley has already received a large amount of rainfall this year. There is a chance that some communities may become isolated for several days. It is now likely that Pilbara will also be affected. While there is no need to panic, it is important for people between Broome and Port Hedland to prepare their homes and follow the directions of emergency services. Now to a COVID update. I can confirm to 8 p.m. last night, Western Australia recorded a total of 1,140 new cases. Of these, there are 1,136 local cases. 4 are travel-related cases. This is off the back of 6,122 PCR tests, not including all of the rapid antigen tests being conducted in the community. Today's cases include 476 self-reported positive rat tests. WA now has 5,540 total active cases. There is good news, and that is the number of Western Australians in hospital COVID is at 11 people, and no one is in ICU. However, we are aware of more admissions since 8 p.m. last night, so we can expect the number in hospital to rise over coming days. The experience over east is that hospital admissions lag about 2 to 3 weeks behind case numbers. So while the current low numbers are encouraging, they will climb. Yesterday, we announced that every WA household could register for 5 free rat tests. I'm advised we have seen, up till now, over 400,000 registrations, which is an amazing result. It shows the demand for this kind of support in the community and the drive to slow the spread of Omicron. A short time ago, we held a meeting of the State Disaster Council, following on from a meeting of the Emergency Management Team, to discuss the current situation and consider the Chief Health Officer's latest advice. As you may be aware, for some time now, there has been discussion around the introduction of more stringent public health measures, or Level 2 public health social measures. We know that public health measures are important for reducing hospitalisations and deaths in the face of Omicron outbreaks. When I outlined the Level 1 public health measures earlier this month, I pointed to the 30% lower death rate in South Australia relative to New South Wales. Experience shows they make a real difference in saving lives. However, as you know, I have been incredibly reluctant to impose Level 2 measures that we have previously outlined, chiefly the 4 square metre rule, which would impact smaller businesses the most. People might question why we would move to higher measures so soon after the rollout of Level 1 measures, especially with such globally high vaccination rates. However, with Omicron, its defining feature is the speed at which it spreads. In Australia, the data shows that once a jurisdiction hits 1,000 cases a day, the peak of Omicron is only a few weeks away. In South Australia and Queensland, they reached the peak of their outbreak in around 17 days. In New South Wales and Victoria, it was 21 days. The latest advice is we should now expect to see WA reach the peak of cases in the next 2 to 3 weeks or so. That is how fast we expect Omicron to spread here. Therefore, if we want a set of measures to be effective, they need to come in sooner rather than later. And they will only hopefully be required for a modest period of time as we get through the coming peak period. Secondly, given Western Australia's strong uptake of third doses, a world-leading vaccination rate, we have been able to review the proposed Level 2 measures to reflect our high vaccination rate and better target high-risk settings, and essentially avoid the widespread use of the 4 square metre rule. So it is clear to help minimise the surge in hospitalisations and protect the broader community, WA will need to move to level 2 public health measures, but they will be less severe than previously outlined, thanks to WA's high vaccination rate. So effective 12:01 a.m. on the morning of Thursday, March 3, that's this Thursday, in line with WA's border coming down in full, the following measures will come into effect. Mask requirements will be expanded to include anyone in Year 3 and above. Hospitality venues, fitness venues, entertainment venues, museums, galleries and places of worship will stay at the 2 square metre rule, but they will be capped at 150 patrons, and seated service rules will apply. Seated and forward-facing entertainment venues like theatres and cinemas will be at 50% capacity, as will major stadiums. The Crown Complex gaming floor will have the 4 square metre rule and seated service requirements in place. However, the other venues inside Crown will follow the 2 square metre rule and 150 patron capacity limit. Nightclubs will have the 2 square metre rule with a capacity limit of 150 and seated service. The 2 square metre rule will also apply for beauty salons, hairdressers and the like. Outdoor public events will have the 2 square metre rule capped at 500 patrons with mask wearing. Outdoor private gatherings in public places are limited to 50 people. Higher education facilities, including TAFE, pathway colleges and English language schools, will have the 2 square metre rule indoors and outdoors with capacity limits of 150 people per lecture theatre. Aged care and disability services will be restricted to 2 visitors per resident per day. There will be no visitors at hospitals except for spouses, parents and carers, birth partners, or for other compassionate reasons. I repeat, except for spouses, parents, carers, birth partners and for other compassionate reasons. Home gatherings are limited to a maximum of 10 people indoors and outdoors. Unfortunately, we know from the experience around the country that it is the home gatherings of families that cause the most spread of the virus. And we know that many families are already doing the right thing and minimising contact, particularly protecting the most vulnerable in their family, which is so important. We understand that weddings and funerals are special days, and these events, including a wake, do occur at the private home. Therefore, weddings and funerals that do occur in the outdoor area of a private home can have up to 150 people, with the 2 square metre rule also needing to be applied. And weddings and funerals more generally, held at other indoor or outdoor venues, will be required to abide by the 2 square metre rule and also capped at 150. Indoor community sports must adhere to venue requirements with no spectators permitted except parents and guardians. For outdoor community sports, the same spectator requirements apply. By using the 150 patron cap instead of the 4 square metre rule, we spare smaller, lower risk venues such as cafes and restaurants from the impacts, while at the same time slowing the surge in cases. While we have avoided some of the tougher measures, this will still be an impact on many operators and on people's lives, and for that I'm sorry. But there are 3 things that are important to keep in mind. 1, there will be a new round of financial assistance to businesses impacted by these measures. These will be announced later this week. 2, these level 2 measures will only be in place for a short time, hopefully around 4 weeks, and they will be reviewed before the end of the month. 3, WA is about to enter our rockiest month. Based on the experience over East, this Omicron outbreak is expected to peak before the end of March. Case numbers will dramatically rise. Hospitalisations will rise. Some people will get very sick, and tragically, some people may die. March will be the most difficult month March will be the most difficult month Western Australia experiences in this whole pandemic, and we would be irresponsible if we didn't have the most appropriate measures in place during the period where they are most required. Everything in this pandemic is a balancing act, striking the right balance to save lives, ensuring we do do what we can to stop Omicron wiping out businesses. As we've done from the beginning of the pandemic, today's announcement is based on the most up-to-date health advice. By making the tough call now, we'll keep hundreds of people out of hospital during the peak of this outbreak. I'll take questions in a moment, but now I'll hand over to the Health Minister.
Thank you, Premier. I will now take you through an important update regarding two of our remote communities. Last week, WA Health reported that 44 people in Bidjadanga and 11 people in Beagle Bay tested positive to COVID-19. Secondary PCR testing has now been carried out and found that while these people do have respiratory infections like the flu and rhinovirus, they do not have COVID-19. All initial tests for the people in Bidjadanga and Beagle Bay were carried out using two GeneXpert PCR machines provided by the Commonwealth to the Kimberley Aboriginal Medical Service. It's believed these machines reported results which are now considered to be false positives. Health authorities have ceased using these machines and a replacement machine has been sent to Broome by PathWest. The Kimberley Aboriginal Medical Service is currently on the ground in Bidjadanga and Beagle Bay, informing residents now. This will be a relief for the community and I want to thank them all for doing the right thing. We took a careful approach to protect these vulnerable communities and the community responded really well, so thank you. I also want to thank the Kimberley Aboriginal Medical Service for their rapid response, and we all have to continue to work together and remain vigilant against COVID-19. Yesterday, 6,122 people were tested at our state-run and private pathology clinics yesterday. We want to get our testing numbers up. I cannot stress this enough. If you have any symptoms or have been to an exposure site or you are a close contact, please get tested. Get vaccinated, including your third dose when you are due. Check the exposure sites regularly. Continue to use the Service WA and Safe WA apps. Wear a mask at indoor venues. Please keep your distance from others and wash your hands. It is responsibility for all of us to protect the most vulnerable in our community. The higher the testing numbers, the more confident we can be that our daily case numbers are reflecting the amount of virus in the community. We need as many people to get tested as possible. I'll now hand back to the Premier.
Right, thank you. Any questions?
Can you clarify, please, is the level 2 restrictions applying only for the Perth and your regional statewide?
They're statewide. So these restrictions will be in place across Western Australia. We're very hopeful it will only be for 1 month. We will assess these restrictions in the lead up to the end of this month, the end of next month, end of March, and hopefully we'll be able to pull back and go back to level 1 restrictions, but we'll just assess that at that point in time.
Hospitalisations are very low. Why bring this in now and not wait until they start to rise?
So the experience over East, and we've queried that at length, is that the hospitalisations increase, and so there's normally a lag of up to 2 to 3 weeks, but generally from the point we're at now to the peak, it's 2 to 3 weeks, and the hospitalisation rates will increase dramatically. So the way to drop the hospitalisation rates and the way to soften or flatten the curve is to put in place restrictions like this at this point in time, rather than wait until that point in time. But the good thing about these restrictions is they are not as severe as what we thought we would have to do, and certainly not as severe as some other states have put in place during the peaks of their infection. And that's because we've got to such high vaccination rates. So our first dose is somewhere around 99%, our second dose is around 96, 97%, our third dose is around 63%. Hopefully it'll be around 70% by Thursday, and climbing rapidly. So we're actually in a very good position, and we've actually got ourselves to the safest position we can. But these measures, unfortunately, are needed at least for the next month.
The indoor gathering limit, does that include household residents and children under 12?
Yes, it does.
Making masks mandatory for Year 3 and up, will that reduce the number of kids required to isolate as a result of close contact? Currently, primary schools, entire classes are
Yeah,
having to isolate.
that's right. It does, because if everyone is wearing a mask in the room, it removes the requirement to isolate. So, look, I know it's not easy. I know a fair bit about young kids from the age of year 3 to year 6, which is what we're dealing with. It won't be easy, and it certainly won't be easy for teachers and aides. But I just ask them to, bear with us. Hopefully, this is only for a month.
Teachers still exempt?
I'm sorry.
Teachers still exempt while teaching?
No, they're required to wear a mask. I understand.
They can remove a mask
Yeah.
if they need to be understood.
Yeah, that's right. They can, and I expect a bit of common sense will kick in, but hopefully this will remove the requirement for children to have to isolate, and therefore parents to have to stay home to look after children from the workplace, and all of the ongoing consequences of that.
If hospitalisations remain as low as they are next week, will we get rid of these restrictions, given we'd be on a different path as the other states?
The plan is for these restrictions to stay in place for the next month. We are expecting hospitalisations to rise dramatically. That has been the experience in every state of Australia.
Every state had a much lower vaccination rate than
Yeah.
we do, and had more hospitalisations at this point than we do.
We're doing better. There's no doubt about that. We're doing better, but the plan is for this to be in place for a month. As I've repeatedly said here, other states have had 6 months, a year, something of that nature, with extended restrictions. Maybe Victoria, 18 months, extended restrictions. Hopefully this will only be for a month.
Having been through these restrictions a couple of times now, a lot of businesses, particularly in hospitality, are saying that it just may not be worth them trading other than takeaway. What do you say to them?
Look, we feel for them, and we're going to do more. We announced a package last week. We're going to announce another package this week to support businesses out there across the community. We feel for them. But the way these measures are designed, it's especially designed to assist the smaller venues, your cafes, your restaurants, your small bars. Unfortunately, for the bigger venues, your bigger pubs and your nightclubs, which are generally the bigger spreading events, there will be some stronger restrictions put in place around them. So that's really unavoidable, but it's based upon health advice, and it's designed to stop the spread of the virus.
What day will you announce those compensation measures?
One day this week.
Why can't you announce them now alongside the
Well,
restrictions?
you worked them through. So we got the medical advice today around the exact restrictions. So we have to therefore calibrate the compensation measures based upon the exact restrictions that we've been given.
More rapid tests are being used now, but there's still been a lot of long queues at some testing clinics today, and a lot of complaints that testing clinics are closing at midday on weekends, 4 p.m. weekdays. Why haven't, given the advice is that PCR tests are still preferred, why haven't the opening hours been extended so people can get tested outside of work as soon as they get a text message and are notified?
Well, we have a testing capacity per day of 30,000 PCR tests, which is pretty extensive. But we're generally getting, 10,000, 12,000 tests per day. So we're only using a third of our capacity. So extending clinics when you already have huge spare capacity probably wouldn't be a good use of resources, particularly because a lot of the staff who work in the clinics are the sort of people we need to work in hospitals and aged care and the like.
Are we moving to very high caseloads?
Shortly. We haven't received advice on that, but shortly. So we've already kicked that in for the health workforce and the police workforce. So at some point in time, we'll kick it in for other parts of the workforce as well, but I don't expect that will be far away.
Why not bring it in at the same time as these restrictions?
Well, we may do, but we haven't received advice to that effect. But all I'd say about that is just got to understand, when you go to the critical worker definitions under the high caseload setting, what you're going to do is enhance the spread of the virus. That's what's going to happen. But at the same time, we keep more people at work, particularly in critical industry. So it's a bit of a paradoxical manoeuvre, if you like, but it becomes necessary at some point in time. The experience of the eastern states shows, and we'll do it when it's necessary.
Nightclub capacity of 150 seated service. What about dancing? What's the rules around that at the moment under these restrictions?
Well, I don't think there's any restrictions on it, but it won't be easy for nightclubs, to be frank with you, and that's why we're going to have some compensation measures for businesses like that.
We've seen PCR testing rates drop to about half of the normal rate when it comes to weekends, yet the case numbers have stayed about the same. Does that show, is there likely a lot more of the virus out there than what is being picked up? And does it also show a West Australian complacent about getting tested for the virus?
We don't know how many rat tests are being done. You can't measure that, but I expect it's many thousands every day. You know, I've been doing them myself, so I expect many people are out there doing them every single day. Are people complacent? Generally, West Australians have been very compliant and very understanding, in my experience, certainly. And when I talk to other states, I just get the feeling West Australians have been more willing to do the right thing during difficult times. But obviously, March will be our most difficult month of the last 2 years, but considering our high vaccination levels, I'm very confident we will get better through this better than any state in Australia, perhaps any place in the world.
Just going back to the decision to keep these measures in place for a month, why isn't there more leeway around reviewing it if case numbers or if hospitalisations more importantly stay low?
Yeah, well, we base what we do on the experience in the other states and what they have seen. So today in New South Wales, whilst we have 11 or 12 people in hospital, today they have 1,136. Victoria has 283, Queensland has 311. At various points in time, they've had multiples of that. So that's what we base our experience on. But our plan is, and you know, limiting these enhanced restrictions, we hope to 1 month, is actually a very short period by Australian standards. Very short period. So hopefully that's all we have to do. But we'll monitor it over coming weeks and hopefully we can pull it off at the end of that month.
Is an earlier review completely ruled out if hospitalisation numbers do stay very low in 2 weeks?
Look, our expectation is that case numbers and hospitalisation will grow.
Those other states that you've just mentioned, they're all removing restrictions, despite their hospitalisations being a lot higher than they are here. So why go so early with such high level restrictions?
Just repeat to you all again. They've been going through these things for months and months and months and months. Victoria for years. I mean, we haven't. We've barely had any restrictions at all. We had 3 short lockdowns since April 2020. Victoria's been through months and months of kids not going to school, of businesses being closed, of extreme restrictions. New South Wales since I think it was June of last year, what are we now, February? They've been through months and months of extreme restrictions. Queensland since they opened their border, South Australia since they opened their border. South Australia's had the 7 square metre rule in place for gyms and other venues. I mean, their restrictions are extreme compared to what we've gone through. So I realise this is an unpleasant experience, but by Australian standards, it's actually the most modest restrictions, the least imposition, and we have the financial capacity because we kept COVID out to make sure we put in place a proper support package again for business.
It just seems like it's a little bit imbalanced given our vaccination rate is so high. People will be wondering why we bother to get so high. You're about to cripple some of the biggest venues in town like the Camfield.
We got to such high vaccination levels because the government was prepared to do difficult things, and that saved a great many lives and meant that we are in a great position to have some of the most modest restrictions put in place in Australia.
But would you expect it to limit any resurgence of the tourism industry when the border opens, given people now will be flying into the most restricted state in Australia while everywhere else is easing restrictions?
The other states still have restrictions. Don't get me wrong, they still have restrictions, and I think there's quite extensive restrictions across Australia. It's just some of their restrictions have been quite extreme for a long period of time, so they're easing them off. What we predicted last year was that when borders open, there'll be a net outflow of people, and so a reduction in tourism will be what happens. So I know some people seem to think there'll be some sort of tourism nirvana come about, but it's not going to happen because West Australians are more likely to travel elsewhere than people coming, and that will outbalance people coming into Western Australia as tourists, at least in the short term. So that's why it's been very good to have kept Omicron and Delta out for a long period of time, so we could build up our financial capacity, and we can assist businesses as we have to get through this difficult period.
The machine in the Kimberley, which led to those presumably false positives, how many more do we have in Western Australia, and are they being tested to ensure this doesn't happen again?
Well, it's a Commonwealth machine, so it's up to them. But we relied on the results from machines provided by the Commonwealth.
Dr. Amber-Jade said it very clear that on the commentary last night on the news, he said, and I quote, "In these circumstances, based on the current circumstances, a positive rat test is around 50% likely to be positive." And then he says, PCR tests are still needed to confirm rats. What do you have to say about this comment?
Look, my advice is that rat tests are about 95% accurate. Andy?
It will vary at what stage of disease, but certainly with symptomatic disease, they have a high level.
They have a reasonably high level of accuracy. But a lot of people who get a positive RAT test will go and confirm it with a PCR test, which is probably advisable as long as you do it safely. But if you get a positive RAT test, you probably do another one and then another one just to make sure that it's accurate. Then, you know, the advice is you stay home for 7 days, or at least until you're not symptomatic.
The false positives up north, what damage does that do to trust that wasn't easy to win in some of these communities?
Yeah, it's very unfortunate, and obviously it was outside of our control. You know, we were using a Gen X machine that produces a PCR result. So it was an accurate, regarded as a very accurate way of assessing these things. We didn't provide the machine, the Commonwealth Government did.
Have you got any confirmation of any more numbers of cases linked to either your Chief of Staff or the Minister for Water, and also Acacia Prison, and any comment with regard to whether concerns about COVID there had contributed to the riot yesterday?
Firstly, in relation to my Chief of Staff, I've had no advice of anyone else linked to him who's positive, and the same with the Minister for Water, but obviously I wish them both all the best on a speedy recovery. In relation to Acacia, there's no advice that it was related to the test results. Basically, a group of prisoners have behaved extremely badly, and full force of the law will be applied.
There have been complaints that the COVID positive inmates were being moved potentially to more restrictive facilities, and also that some prisoners are supposedly being refused masks.
I find that highly unlikely, the second part. And the first part, obviously if people are COVID positive, you try and put them in an environment where they're not going to spread the virus, so that would make total sense. Look, we had a program roll out to get prisoners vaccinated. Number of prisoners declined, but we've put the opportunity out there for them to get vaccinated repeatedly.
Are our prisons safe, especially if inmates react to harsher visitor restrictions and the like in a COVID environment?
Well, they're prisoners. They're in jail. And so therefore we have strict regimes around them to ensure that we don't allow them to escape or to cause more grief. But we provided the opportunity for them to get vaccinated. We're doing all we can in a difficult environment to deal with COVID. I just encourage any prisoners who aren't vaccinated to take the opportunity.
Are there enough staff at Acacia Prison?
Yes, it's fully staffed.
On the free rapid antigen tests, we've heard from people in the disability sector who said that they were surprised that everyone's getting free rapid antigen tests when they say that they're still struggling to get enough for their own staff to be confident. Is there more you could be doing to prioritise where some of those rats are going?
We are providing them to community service organisations in large numbers, so they're available for those organisations. But making them available to the general public, I think, is a good thing. Making sure that everyone has a stock on hand and they can test themselves if they're unwell or they're concerned they might have been somewhere where someone was positive, so they don't go out again, is a good thing. So we're the only state in Australia, only territory in Australia, or only state at least, only state in Australia we are the only state in Australia to have done this. And so this is the first round. As we get more stock in hand, we'll provide more, and this will give people across the community peace of mind.
You've gone
On
to
those
very high
tests that issue
caseload
with the
settings
email.
for police and healthcare workers. Why not in schools?
Sorry?
You've gone to very high caseload settings for police and healthcare workers. Why not in schools, which would mean a lot fewer students would have to isolate?
Well, I don't think it's far away, but obviously making sure our hospitals, which were suffering from some significant furloughing, and our police as well, could continue to operate was important. As soon as we get advice we need to do it with schools, we will.
The modelling we saw was for level 2 measures, which at the time included the 4 square metre rule. Now that they've been eased, does that modelling change at all? Are we looking at different numbers in the peak?
We'll table it, I'm sure we'll publish it shortly, the advice we receive. But it still does assume and does expect there's going to be a large number of people in hospital, I can actually tell you. A large number of people in hospital and some people in ICUs. So the advice we have indicates that under this regime, I'm sorry, I can't quite find it, but we'll publish it shortly and we'll provide you with advice as to how many people are expected to be hospitalised and go into ICUs. But the good thing is high vaccination levels, which we've achieved in Western Australia, is going to reduce the impact on our health system, reduce the number of people who get seriously ill, and certainly reduce the number of people who die.
Just back to the free rat test, saying there's emails going out saying the address has already been registered. Has that been resolved?
I think they're working to resolve it as soon as they can. The department is working to resolve it as soon as they can. I think what I'm advised is there's a sequencing issue. I don't quite understand what that means, but there's a sequencing issue with emails. But bear in mind, we've had 400,000 registrations. We've had 10,000 people this morning show up to collect their free rats at the airport. So it's been a heavily subscribed program already, and obviously that has some logistic issues, which I'm sure you would all understand.
The G2G system for entry into WA, why is that still required at this point in time, and how much longer will that be in place?
Well, that's in place for a period of time because we need to make sure, in accordance with our rules, that people are vaccinated to the extent they can be. So that's what that system allows us to achieve.
How are you going to cope with that, given a massive influx once the border opens? You know, the airport's saying they expect 15,000 people on the first day. That's a lot of resources checking those.
We already had a lot of people come in, just so you know, since we announced the compassionate grounds and the like. It's been many tens of thousands have already come in quite safely. But as of Thursday, the system will change. But the police, and I must say, I visited the Operation Tide, which is the police headquarters that manage all these things last week. They do an outstanding job and they're very efficient and effective at what they do. And I think they've been heroes of the last 2 years, working hard round the clock in a whole range of areas to make sure that our state was the safest place in the world.
Premier, a bit of a hypothetical, but if PCR is the gold standard, what happens if someone registers a positive rat but their PCR comes back negative? Will they still have to isolate for 7 days?
Okay. I don't think so. No, they don't. No. So the PCR is regarded as more accurate than a rat test. So no, they don't. Are you asking for a friend or yourself?
Just popped into my head because I had been asked by some people about whether or not the rat tests that were being self-reported and subsequent PCRs were being cross-checked to ensure that numbers weren't being doubled.
They are being cross-checked, correct. Yep. But, you know, if you get a positive rat, my advice would be, if you can, go and get a PCR test, and if you can't, do another rat, just confirm, and stay at home for the 7 days.
Heading into this high caseload period, are there behaviours that West Australians need to start doing again? Do West Australians need to stop shaking hands again? Things like that?
I would advise that. You're all sitting here looking at me with masks on. People have been... I walked through a shopping centre yesterday. Everyone was wearing a mask without exception. People are doing the right thing overwhelmingly across the community, but, you know, not shaking hands, I think, is a wise precaution.
On another issue, the Department of Communities raised, was it appropriate for communities to report an alleged whistleblower to police, in your opinion?
Look, that was a decision for the department, and obviously my understanding is there was evidence that an employee had downloaded thousands of documents, including confidential reports about children and foster carers, and had basically taken that information. So that's pretty serious sort of stuff, and so they referred it to the police, and I don't think there's anything wrong with that.
Couple of questions for the Minister.
Nothing more for me?
Just one more thing, very quickly, sorry. The mortgage brokers and property agents believe that once the borders open, the rent's going to go up at least 5 to 10%. In some places, go up to 30%. They said that some people already being forced to live in motels. The whole family got packed into there, and you know, and it's just untenable. Are you concerned about the fact that the rental is going to spike up like that?
I'm concerned. I'd urge all landlords just to be reasonable, and that's why we have the largest home building program, both private and public, underway that we've experienced in many years. Thanks very much.
Minister, are we seeing different symptoms presenting in kids in particular with regard to Omicron? A lot of gastro presenting ahead of positive tests and so perhaps not being picked up by some people?
Well, Omicron does present differently, and gastric-like symptoms are one of the early symptoms in adults and children. So I would urge people to be vigilant, and we are seeing children present to Perth Children's Hospital when parents are worried. So we do know that children are being impacted at the moment.
What would you say to people who think the move to level 2 restrictions is premature, given 11 people are in hospital?
Well, we know that there's a lag in hospitalisations, and the less people that are hospitalised, the less people are going to get really sick, and that's a good thing for the community. So our approach is to have level 2 on for as short a time as possible, and we do expect the surge to be with us soon. So within the next 2 to 3 weeks, we will see those numbers go up very high. If we don't put more stringent restrictions on, we could see the numbers become even higher. So it is, and unfortunately it's necessary to help manage the disease in the community, and our aim is to make it as short as possible for those businesses.
This might be better for the Chief Health Officer, but the modelling that has already been released, how are we tracking in terms of case numbers and hospitalisations compared to where we are now?
On my last briefing, we're tracking pretty on track for the health department's modelling. That we're pretty close to that. For hospitalisation, so we are expecting them to start spiking.
We've had a lot of people asking if there's case data available for localised regional towns and cities, and if it's publicly available.
You mean case numbers?
Yeah.
We tend to, we have case numbers for regions, and they do change and move depending on contact tracing efforts, and I know the contact tracing efforts are still quite intense in regional areas because those numbers are lower. So we don't tend to release them in regional areas or in towns. Our experience has been that sometimes the rumour mill gets ahead of that, and we need to announce our case numbers within 24-hour reporting periods and by region where possible.
Why isn't the regional breakdown provided daily or weekly? There used to be a live map in 2020. Why is that not?
We can look at providing that. Yep, we haven't had any. Is really the answer to that. We haven't had much regional spread at all, but as we get further into case studies, we will provide that region by region.
What demographic is most affected at the moment? Is it still that 19 to 26?
The demographic, and part of the reason we suspect for the low weekend testing numbers is younger people, that they are, and our high rates of vaccination mean that there might be more asymptomatic cases in the community, and they're going out on the weekends, not getting tested until Monday or Tuesday. So they seem to be the most affected at the moment, but they'll start to spread that to family members if they live at home. So we'll see that start to widen out.
Dr. Robertson?
Yeah.
Do you have any concerns about accuracy of RAT tests and then PCR tests, and the people that the fact that Dr. Miller says, okay, we'll suggest them do RAT tests, but then get confirmed by PCR for that anyway?
So, if you're symptomatic, rapid antigen tests have a high degree of accuracy. Obviously, if you're asymptomatic, you don't have any other disease, it is less. But the PCR still remains the gold standard for testing, and that's obviously what we encourage. One of the things that we do get, unfortunately, with rapid antigen tests, as well as getting false negatives, we get false positives as well. And so that's why on occasion we do continue to test people or encourage people to have a PCR test, particularly if they're in key roles where the rapid antigen tests, they're asymptomatic, the rapid antigen test may be a false positive.
The Omicron modelling that was published, have the predicted outcomes in that changed much?
No, the modelling that was published is very much, we're on track on that modelling at this stage. Remembering that modelling actually did incorporate our vaccination status. It also incorporated the public health social measures, both the level 1 and level 2 social measures. Just to talk a bit about that, because there's a couple of earlier questions around what about why don't we leave it and see what happens. If we just left it on public health and social measures level 1, we'd end up with, at peak, 668 general ward admissions, that's the peak day, and 84 ICU admissions. That would be actually, compared to level 2, that's actually 234 more ward admissions we'd have on that day, and 31 more ICU admissions. That is the difference. It is really a significant impact on the number of people being hospitalised and the number of people ending up in intensive care. There is always going to be a delay, and if we wait for the delay, if you wait for the 3 weeks, the impact is now when we're in this rapid growth phase. If you wait to the peak, it's not going to have the impact because you're already, the impacts, the hospitalisation rates are already in play. Remembering that with the disease, most people don't get seriously unwell until they've had the disease for about a week. So all of these factors play into getting that delay and why a decision needs to be made early to actually get to have the real benefit of these measures.
So was it always envisaged that level 2 restrictions would come into play around this time?
Yes, it was.
Why wasn't that announced at the time that we announced level 1 restrictions?
Well, I think we did make some announcements at that time that we would anticipate that the social measures would come in at a later stage. But we were obviously looking at, and we've done some further modellings as to what level that could be, whether it's better at 400 cases or 1,000 cases or 2,000 cases, and it was felt that this was the best time looking at that modelling.
And if we're tracking along in line with that original modelling, why are these level 2 restrictions less stringent than what was originally?
These restrictions are less stringent, but are more targeted. It's really around managing the risk here. So the low risk facilities, like the cafes and the restaurants, those kind of facilities, are disproportionately impacted when you have 4 square metres. If you have a small cafe or a small restaurant, you're not going to be able to have many people, and many of those would not be able to continue to operate. While if you have 4 square metres in a very large facility or a very large hospitality facility, you could still operate, but you may have 500 or 600 people in there, and that would obviously be self-defeating. So this is targeted to say we have a capacity limit that will still enable many of these places to operate, but will reduce the mixing and the numbers so that you don't get the spread going through those communities.
Given Optus Stadium is open air, what tangible difference does going from 75% capacity to 50% capacity make to spread?
So again, people are spread out, and remembering there is also a mask requirement at Optus Stadium, so people will be wearing masks as well. So that will ensure that you're limiting that spread. But there is always that interactions. There's also interactions on trains. It will have an impact. We've seen that again from our modelling.
Just on the current isolation rules, why, given the 7-day close contact requirement is for a PCR test on day 6 or a RAT test on day 7, then once the RAT test returns negative, why do you still have to continue isolating until the time that's been plucked out as the estimated point of exposure for the full 7 days? If your last RAT is negative, nothing's going to happen in the next few hours to stop you leaving isolation. Why do you have to continue isolating after receiving a negative result? Because people game the system is basically, so they'll have it on the 1 minute past midnight to say they've had it on day 7. So it is around, you really need to get the benefit. We've obviously reduced it from 14 days down to 7 days. There is still a small risk that people could be infected and but
get it.
You won't know when they leave isolation because there's no requirement to have another test, so they're isolating with no chance of
But
that
there
changing.
should be no incentives for them to have it early. The incentive is for them to have it as late as they can on day 7, and that's what this is about.
But that's not the instruction they're given. You're not told to have your rat at the last moment of isolation. You're just told to have it at any time that day.
Yeah, look, we have to leave it to people's common sense. It is to encourage people to have the rat at an appropriate time, and not to try and game the system and get out at day 6. In reality, that's what it's about. It's about minimising the risk to the degree we can.
There are more measures that haven't been deployed, and what would it take to see those?
So, look, I think these are the measures that we have obviously calibrated this very much on this outbreak. We understand what the vaccination rates are. We understand what the growth rate is. So we're anticipating that this will be more than adequate to actually address that, and we shouldn't have any further measures. But obviously, we continue to review as always, and if there is something very unusual that arises, then obviously we would have to reconsider it. But we certainly don't expect that to happen.
Do you have an idea of what the third dose vaccination rate is among over 60s?
Over 60s, look, I'd have to get you that figure, but it's probably close to 80%. I would have thought in that ballpark.
Right, thank you.
Thank you.
Thank you.